Puerto Rico Medical Board style cliniphrosis. Clinical vignette: unilateral hydronephrosis in a young adult. A 24-year-old man presents to the clinic with left flank pain that has been intermittent for the past week. He denies fever, dysuria, or hematuria. His past medical history is unremarkable. On physical exam, there is mild tenderness to palpation in the left flank. Urinalysis is normal. Renal ultrasound shows dilation of the left renal pelvis and calyces without signs of stones. Creatinine is within normal limits. A CT urogram confirms hydronephrosis of the left kidney, and a narrowing of the ureteropelvic junction, UPJ, is noted. Which of the following is the most likely diagnosis? A. Ureteral stone. B. Vesicoureteral reflux. C. Ureteropelvic junction obstruction. D. Posterior urethral valve. Correct answer, C. Ureteropelvic junction obstruction. Explanation: UPJ obstruction is a common cause of unilateral hydronephrosis in young adults, often congenital and can present later in life with intermittent flank pain, often after alcohol or diuresis. There is no stone or infection, and posterior urethral valves typically present in male infants with bilateral hydronephrosis. Vignette 2: Bilateral hydronephrosis with BPH. A 70-year-old man presents to the emergency department with decreased urine output, difficulty urinating, and bilateral flank pain. On exam, his bladder is palpable and distended. Digital rectal exam reveals an enlarged, non-tender prostate. Serum creatinine is elevated to 3.2 milligram deciliters, baseline 1.0. Renal ultrasound shows bilateral hydronephrosis. What is the most likely cause of his findings? A. Prostate cancer. B. Neurogenic bladder. C. Benign prostatic hyperplasia, BPH. D. Bladder cancer. Correct answer, C. Benign prostatic hyperplasia. Explanation: BPH is a common cause of lower urinary tract obstruction in elderly men, leading to bilateral hydronephrosis due to backflow of urine when the bladder cannot empty properly. Vignette 3: Hydronephrosis in a pregnant woman. A 32-year-old woman in her third trimester of pregnancy presents for a routine visit. She denies urinary symptoms. A routine renal ultrasound shows right-sided hydronephrosis. Her serum creatinine and urinalysis are normal. What is the most appropriate next step in management? A. CT scan with contrast. B. Begin antibiotics. C. Reassurance and repeat ultrasound after delivery. D. Surgical correction of ureteral obstruction. Correct answer, C. Reassurance and repeat ultrasound after delivery. Explanation: Physiologic hydronephrosis is common during pregnancy, especially on the right side due to mechanical compression by the uterus and hormonal effects on smooth muscle. No treatment is needed unless symptomatic or there's infection. Summary table: Key hydronephrosis concepts: cause, laterality, key features. UPA, UPJ, UPJ, obstruction. Young adults, congenital, intermittent pain, BPH, bilateral, elderly men, post-void retention, unilateral, acute flank pain, hematuria, posterior urethral valve, bilateral infants, male neonates, poor urinary stream. Pregnancy physiologic, right-sided common, no treatment unless symptomatic or infected. Tumors, bladder, prostate, uterine, bilateral or unilateral, obstruction with hydronephrosis. Would you like to continue with